How is the skull flap managed during a craniotomy for brain tumors? Imagine opening a door to access a hidden room in your house. During a craniotomy for brain tumors, surgeons do something similar by removing a small section of the skull called the bone flap. This creates a window to reach the brain safely. The surgeon first makes an incision in the scalp and carefully cuts through the skull with specialized tools, lifting the bone flap away from the brain. This exposes the protective covering called the dura mater and the underlying brain tissue. Once the tumor is located and removed or biopsied, the surgeon closes the dura to protect the brain. The bone flap is then carefully repositioned over the opening. To keep it secure, tiny titanium plates and screws are used. These are strong, biocompatible devices that hold the bone flap firmly in place, restoring the skull's shape and providing protection for the brain. The scalp is then stitched closed over the replaced bone flap, sealing everything up. In some cases, if there is significant brain swelling or other complications, the surgeon might decide not to replace the bone flap immediately. Instead, they may leave it off temporarily in a procedure called a craniectomy. The bone flap is stored safely, often in cold storage or sometimes in the patient's abdomen. Once swelling decreases and the brain stabilizes, a second surgery called cranioplasty is performed to reattach the bone flap. This process of managing the skull flap during a craniotomy is carefully planned to balance access to the tumor with the protection and structural integrity of the skull. Titanium fixation devices have made this process safer and more reliable, helping patients recover better and reducing the risk of complications. Overall, the goal is to remove the tumor effectively while ensuring the skull remains strong and protective after surgery. Remember, every patient's situation is unique, and your healthcare team will tailor the approach to your specific needs. Always consult with your surgeon or medical team about any questions or concerns regarding your treatment.